I'm going to define what a hernia is. The body is broken down into cavities or compartments: cranial cavity, chest, and abdomen. And the arms and legs are broken down into compartments. When something migrates out of its normal domain, that's a hernia. If your brain migrates out of your skull, that's a brain hernia. If your stomach goes into your chest, that's a hiatus hernia. It gives you reflux or GERD. The most common site for hernia is in the area of the belly button or umbilicus. All mammals have umbilical cords that connect them in utero to their mother's placenta. The umbilical cord goes from the placenta through their belly button to the liver so they can get oxygen and nutrients exchanged as a fetus. When babies are born, by definition, they have a belly button hernia. These hernias will almost always close between the ages of 4 and 6. However, if you have an outie, by definition, you have a belly button hernia, and sometimes even if you don't, you can have a small defect. These are not repaired unless there are specific indications. If the hernia is getting bigger and it's symptomatic, that is a reason. If the skin changes or the contents get stuck and you have a lot of pain, that's another reason they can be repaired. And sometimes they're repaired just for cosmetic related issues. The second most common site is in the groin. And in the groin, there are 4 types of hernias. The first is a femoral hernia. There are blood vessels that go from the abdomen to the leg, and around them you can get a defect and a hernia in that area. That's called a femoral hernia. It's around the blood vessels. It can contain either fat and or intestine. It is very common in women, about 90 to 95% in women, less common in men. The second type of hernia is a sports hernia. It's what I see in the professional athletes sometimes that I operate. It's mostly in patients who torque their upper body against their lower body, more common in hockey players, soccer players, or baseball players. If a patient has a true sports hernia, they may require an MRI or other workup, but in fact, most patients come with sports hernias don't have real sports hernias, but in fact just have old-fashioned congenital indirect inguinal hernias. The third type in the groin is either a direct or an indirect inguinal hernia. The testicle as a fetus is on your kidney and migrates in the scrotum, and it does that in order to be below body temperature to make viable motile sperm. It goes through the muscle, 3 muscle layers in the abdominal wall, and usually they repair and a baby is born and the muscles are intact. If there is a hole in those muscles, that's called an indirect or congenital type of hernia, and babies can be born with it, and it requires surgical intervention. It's the most common hernia we see in teenagers and people in their 20s and 30s, and even the most common that we see under 50. The fourth type is a direct inguinal hernia. With bipeds, we stand on our feet, gravity pulls things down, and over time, elasticity and water content changes as you age, and you can get just a defect as you get older. Whether you have a direct, an indirect, or a femoral, and even in some cases, a sports hernia, the repairs are essentially the same. Hernias should be repaired if they're symptomatic, if they're getting bigger, if they've been stuck, or if it's cosmetically displeasing to the patient.